Acetydona 200 mg uses, dosage, side effects, and precautions. This article is for informational purposes only and does not substitute professional medical advice. Please consult your doctor or pharmacist for advice and instructions on the most appropriate use of the drug. Uses mucus thinning. Acetylcysteine is a mucolytic agent that helps to thin the mucus in the respiratory tract, making it easier to expel and improving respiratory congestion. Uses paracetamol overdose antidote. Acetylcysteine is an effective antidote for paracetamol overdose. It helps to prevent the formation of toxic substances caused by paracetamol, protecting the liver from damage. Mucus thinning. Adults 200 mg per dose, 3 times a day. Paracetamol overdose antidote. Initial dose 140 mg/kg body weight. Subsequent doses 70 mg/kg body weight, every 4 hours. Total doses 17 doses. Note: acetylcysteine is most effective when used within 8 hours of paracetamol overdose. After 8 hours, the protective effect of the drug decreases. Treatment should be started as soon as possible, and should not be given more than 15 hours after paracetamol overdose, as the drug will no longer be effective. Common nausea, vomiting, abdominal pain, diarrhea, rash, itching. Uncommon allergic reaction, dyspnea, edema, hypotension. Rare anaphylactic shock, respiratory failure, renal failure, disseminated intravascular coagulation. Overdose. In case of acetylcysteine overdose, patients may experience symptoms similar to anaphylaxis but more severe, especially hypotension. Other symptoms may include hemolysis, respiratory failure, disseminated intravascular coagulation, renal failure. Overdose deaths have occurred in patients who have overdosed on acetylcysteine while being treated for paracetamol poisoning. Overdose management. Treat symptomatically. Precautions: do not use Acetydona 200 mg if you are allergic to acetylcysteine or any ingredients in the drug. Do not use Acetydona 200 mg in children under 2 years of age. Use Acetydona 200 mg with caution in patients with asthma, respiratory failure, renal failure, liver disease. Precautions: consult your doctor or pharmacist before using Acetydona 200 mg. Always follow your doctor or pharmacist's instructions on dosage and how to use the drug. Store Acetydona 200 mg at room temperature, in a dry place, protected from direct sunlight. Additional information: acetylcysteine is a prescription drug and should be used as directed by a doctor. Do not self-medicate with Acetydona 200 mg without consulting a healthcare professional. Note: this article is for informational purposes only and does not substitute professional medical advice. Please consult your doctor or pharmacist for advice and instructions on the most appropriate use of the drug.